Good evening, all. I'm Dr. Nigil, Clitus, consultant interventional cardiologist in Indira Gandhi Cooperative Hospital, Kochi. Today, I would like to talk about a very important heart condition. I'd like to talk about heart health in young adults. What the under 40 age group should be knowing. So, imagine being in your 30s when you are active, you are working. Suddenly, a heart attack changes everything. It may sound shocking, but this is more common than many people realize. And what the current statistics say that heart attacks are no longer a disease of old age. In India, we have heart attacks which are rising at an alarming rate among younger adults. So, we need to know what is a heart attack. A heart attack happens when the blood flow to a part of the heart it is suddenly blocked. Usually, it is due to a blood clot in one of the blood vessels supplying the heart. What happens is this cuts off the oxygen to the heart muscle and it leads to permanent damage, or it can even be fatal if not treated quickly. So the important point is most of these heart problems they do not appear overnight. They develop very slowly, silently over many years. So the choices which we make, the food which we eat, how active we are physically, how well we manage our sleep, how well we handle the stress, whether we have other bad habits like smoking, all this slowly shape the health of our heart. So if we look at the incidence of heart attacks over the past few years, the deaths due to heart attacks they have increased sharply. And in 2022 alone, there was the statistics say that there was a 12.5% jump in heart attacks. And the even more worrying thing is the Indian Heart Association reports that half of all the heart attacks happen in Indian men before the age of 50, and 1 in 4 heart attacks occur at a young age of before 40. So we need to know why a young person is at risk. So in the new era, in this new age, what happens is change in lifestyles like unhealthy diets, lack of exercise, high stress due to the highly stressful job situation, smoking, alcohol, and also the rising rates of obesity, high BP. All these are factors which contribute to the damage in heart vessels, and also they increase the chance of heart attacks at a younger age. So also these risk factors they begin in the heart long before the symptoms even start. So the young adults what they may not be even realizing that they have a heart condition until it strikes them. So another thing is after the effects of COVID-19, heart attacks and other issues they are becoming more common because of the COVID related issues. And the important thing is we don't need to lose hope, because there's a good news that many of these heart problems they are preventable. If we act in time, this can be prevented. So if you look at the heart health through the decades, this heart problem which starts in our 40s or 50s, it is not a problem which suddenly starts. It's a problem which starts even in our 20s. So if we look at the 20 age group, at this time, this is the time when we have to act. The good habits which we cultivate at this age, they make a big difference. We need to get regular health checkups. The most important thing is know your numbers, know your blood pressure, cholesterol levels, sugar levels, and maintain a record of your weight. Then stay active, avoid smoking, avoid all bad habits like drug abuse. Then the healthier you are at your 20s, it's easier to keep or stay healthy as the age progresses. Now when you get into your 30s, in the next 10 years, life definitely gets busy, but your heart still needs attention. And the most important priority during your 30s is to make healthy eating a very important part of your family life. And also, you have to have an awareness about the family history of heart disease. Also, another thing is during the 30s, another important thing is job stress. Stress has to be managed with relaxation, with hobbies, with regular exercise. And also, long-term stress is a very important point which needs to be taken care of in the 30s. Long-term stress has a lot of adverse effects on blood pressure. It damages arteries. So we need to learn to unwind. That is a necessity. It is not a luxury. So once you get into your 40s, what happens is your body begins to change. At this age group, you need to watch your weight because your metabolism definitely slows down. So you have to watch your weight to see that you have to maintain your healthy body weight. Then you have to get your blood pressure, blood cholesterol levels, blood sugar levels checked. And another thing is during your 40s, most people have a common problem called sleep apnea. That is a very most of the people think that it's a harmless thing to be snoring during sleep. That is not a thing to be ignored. It could be sleep apnea, which also increases the risk for heart disease. And even if you haven't focused on your health, you have to start it at this age at least 40 years. Now, once you get into your 50s and beyond, the risk of heart disease definitely increases, especially in women, because still menopause, estrogen is a hormone which protects the women, and keeps the heart blood flowing without getting clots. So once menopause is attained in women, the risk for heart disease is the same as men. So in your 50s, you need to walk more. You have to have a healthy, home cooked, balanced diet. Always, most of the people have some diseases like blood pressure, diabetes, or cholesterol. Take your doctor's advice. Take medications if required. Have a heart healthy diet. So the heart can get stronger at each decade. Each decade, you need to have a specific kind of protocol and specific kind of lifestyle changes, and if needed, medications to keep your heart healthy. And one thing which we need to know is heart disease doesn't start in old age. It starts with small everyday choices which you make, and these choices have to be made years earlier before you even get into the symptoms. And the earlier you care for your heart, the longer and the healthier your life can become. Thank you.